Welcome to the nutrition session of the Africa Health Agenda International Conference 2021. The theme of the session is multi-sectoral collaboration in nutrition programs in Africa and relevance to primary healthcare and universal health coverage. I am your moderator, Jacqueline Kongo. So the objective of this session is really to share the best practices and lessons learned from two nutrition multi-sectoral, multi-stakeholder projects implemented at subnational level in Ethiopia and Senegal. We will attempt to answer three questions from this session. The first question is, how can multi-sectoral approach in nutrition programs help communities to receive essential primary healthcare services and contribute to universal health coverage? The second question is, what is the role of technical assistance in supporting government to plan, implement, monitor, and evaluate multi-sectoral programs? The third question is, what is the role of governments and donors in scaling up key nutrition interventions in the context of universal health coverage? We will have two sections in this session. The first section has two presenters. Panel 1 has two presenters, and panel 2 has 4 panelists. Before I introduce the first presenter in panel 1, I just want to welcome the participants and just to remind you that if you have any questions for the panelists, kindly write them out in the chat box, and the presenters and panelists will be monitoring the chat box and respond to you directly. So our first presenter is Dr. Cisse Sinamo Boltena. Dr. Cisse is a senior program manager seconded by Nutrition International to the Seqota Declaration Federal Program Delivery Unit in the Federal Ministry of Health in Ethiopia, where he provides technical assistance through Nutrition International. He is responsible for technical and administrative leadership for the federal and 2 regional program delivery units, where 9 sector ministries implement the Seqota Declaration innovation phase. Seqota Declaration is the Ethiopian government commitment to end stunting among children under 2 years by 2030. Dr. Cisse holds a degree in medicine from Addis Ababa University Medical Faculty and a Master of Public Health degree and PhD in Public Health Nutrition from University of Western Cape, South Africa. He has 19 years international experience in development and emergency health and nutrition, multi-country programs and program leadership across 26 countries in Africa. Dr. Cisse has also been engaged in a number of regional initiatives. For example, he's participated in the African Nutrition Leadership Program, as well as is the current Secretary General for the African Nutrition Society since December 2020. Welcome, Dr. Cisse.
Thank you so much, Dr. Jacqueline, for the kind introduction. As it was indicated in the introduction, I will be speaking on the Seqota Declaration, which is an innovative multi-sectoral nutrition implementation by the government of Ethiopia and the role of Nutrition International Technical Assistance. This presentation was prepared with support from Nutrition International's Nutrition Technical Assistance Mechanism, NTEAM, under the Technical Assistance for Nutrition (TAN project, funded with UK aid from the UK government in collaboration with the government of Ethiopia and its Seqota Declaration Federal Program Delivery Unit. So the objectives of today's presentation is to share the government of Ethiopia's experience in implementing the Seqota Declaration multi-sectoral nutrition program, and to share how Nutrition International's technical assistance has contributed to supporting the government in planning, implementing, and monitoring and evaluation of the Seqota Declaration. So to give you a little bit background on Seqota Declaration, the Seqota Declaration is a government commitment to end stunting in Ethiopia among children under 2 by 2030. And when the declaration was unveiled in July 2015, the government is committed to preventing an additional over 7.8 million children from becoming stunted to enable them grow to their full potential. The Seqota Declaration is a multi-sectoral, multi-stakeholder program where 9 sector ministries work together under the highest government leadership at federal and regional level, and many development partners and donors are involved. Seqota Declaration has a number of development partners and donors from the UN family, local civil society organizations, international NGOs, development associations, research institutes, as well as donors that are working together and committed to the ending stunting goal of the government of Ethiopia. The Seqota Declaration has a 15 years implementation strategy, which we call it the roadmap, where 9 sector ministries, namely health, agriculture, water, irrigation and energy, education, labor and social affairs, women and children affairs, transport, finance and culture, and tourism work together to achieve the Seqota Declaration goal. As part of the innovation phase, we are testing 6 innovations that will be implemented to address challenges of multisectoral coordination. These are the federal and regional level program delivery units that are specifically addressing issues of governance and coordination among sectors and development partners. The second one is a community lab that addresses issues of community participation, ownership, and also development of local solutions and local level multi-stakeholder coordination. The first 1,000 days plus public movement, it drives behavior change communication by mobilizing frontline workers, service providers, as well as also community and religious leaders in the media. The Agriculture Innovation and Technology Center addresses issues of technology related to effective and efficient water and irrigation agricultural irrigation technology utilization. The Coastal Warada-based nutrition, multisectoral nutrition investment plan addresses issues of planning, multisectoral financing, resource mobilization, as well as funding allocation from government, as well as development partners. And finally, the 6th innovation is on the data revolution, which addresses the key issue in multisectoral coordination related to data generation, accountability, and also decision making. The 15 years roadmap is divided into 3 phases. The innovation phase, we are now just concluding. It is a learning by doing phase. And the second phase is the expansion phase. It extends up to 2025, where we will be reaching more high stunting prevalence waradas and communities. And the national scale-up will also start by 2026. Currently, the innovation phase covers 40 districts or waradas in Amhara and Tigray regional states, serving over a total of 4 million people, where the prevalence of stunting is as high as 48%. So what is the Nutrition International Technical Assistance support that we are also providing through NTEAM? So the objectives of the NITA is to provide technical assistance for effective design, implementation, and monitoring of the Seqota Declaration, support development and implementation of a framework to facilitate multisectoral coordination and result-oriented engagement, and finally, to facilitate institutionalization of systems for continuous documentation, learning, and adoption of good practices during the Seqota Declaration implementation. So in the past over 4 years, this technical assistance has contributed in a number of ways. Just to give you a little bit of the highlight, in terms of the multisectoral coordination, we established 3 program delivery units composed of multidisciplinary teams, coordinating by annual high-level multisectoral platform meetings at federal and regional level to review Seqota Declaration implementation performance. And in terms of the costed Warada-based planning, supported 40 Waradas that are currently implementing the innovation phase to develop and implement annual costed multisectoral nutrition plans by providing technical oversight. In terms of resource mobilization, supported mobilization of over 62 million USD from the federal and regional government treasury, and also additional funding coming from development partners, and conducted resource tracking and partnership management in the 40 waradas. In terms of monitoring and performance management, disseminated multisectoral performance management scorecard to the steering committees and sectors that are implementing the Seqota Declaration implementation plan. And also these scorecards are being used to make informed decisions on the areas requiring improvement of the sectoral plan implementation. In addition, at the beginning of the interventions, we facilitated the baseline study to set benchmarks and targets to guide implementation priorities, and also developed innovative multisectoral reporting and data tracking system for sectors KPI monitoring. And finally, to facilitate the next phase, which will start as of July 2021, we led the development of the expansion phase concept note with the aim of reaching 700 waradas by 2025, where 200 of them will start implementation in July 2021. And currently, we are working also the investment plan development for the expansion phase with Nutrition International technical support. Thank you for listening, and over to you, Dr. Jacqueline.
Thank you so much, Dr. Boltena, for your presentation, for highlighting to us the Seqota Declaration and what TA Nutrition International is providing to the Seqota Declaration. Our next presenter is Dr. Bala Didio. Dr. Bala is the Country Director of Nutrition International Sahel Office. He has more than 20 years experience in public health and expertise in the health systems and health policies of West African Francophone countries. He has worked with Nutrition International since January of 2015 as the Country Director for Senegal and the Sahel region. He manages Nutrition International collaborations in the country and promotes nutrition programming in support of the governments of Burkina Faso, Mali, and Niger, and their respective strategies to reduce child mortality, promote child development, and improve women's health. Bala holds a PhD in public health and a master's in international development, both of which are from Tulane University in New Orleans. He has a degree in medicine from Cheikh Anta Diop University in Dakar, Senegal. Welcome, Bala.
Thank you, Jackie. Good morning, good afternoon, everybody. I'm going to present you a case study of a multisectoral collaboration in nutrition program in Senegal through a case study of our program named PINKK, which is the Integrated Nutrition Project in Kolda and Kédougou Regions. This is the overview of my presentation with the objective, as Jackie highlighted, to showcase the PINKK project innovative multisectoral approach in the implementation of nutrition intervention that improve access to primary healthcare and contribute to universal health coverage in Senegal, and to discuss the best practice and lesson learned from the PINKK project supported by Nutrition International. As the background for the project, we received in 2015 a grant of 20 million Canadian dollar from GAC bilateral branch to implement this project for 5 years until 2020. The location of this project is in the region of Kolda and Kédougou, and all departments in these two regions are concerned. We choose these two regions also because nutrition, health, and food security indicators are the worst in Senegal. During this project, we are targeting at least 50 women, mainly lactating and pregnant women, 115,000 children under 5, among which 16,000 was under 2, and we are also targeting 30,000 vulnerable households. With the objective of improving the nutrition security of the population, especially among children and women in these two regions. We were expecting 3 results. The first one is to improve nutritional practice, including diet, health, and hygiene. The second one, increase access to micronutrient-rich food for the same targets. And the last one is to improve management of nutrition-related aspect in the plan and program of the government of Senegal. This project is designed, but also in the implementation, use a multisectoral approach with two components. The first one is the integration of relevant food security, health, and nutrition action into the program, mainly integrating an integrated multisectoral design. But also we are targeting one planning framework because the umbrella in which we were operating is one PINK. It's not PINK for this organization or for this implementing partners. We also use the gender transformative approach, and we harmonized the coordination mechanism at all levels, beginning from the national level where we have a steering committee and a technical committee, until the village level where we have a village committee, steering committees. Mainly, we have also many women participating in these village steering committees. To innovation, we use a household-centered approach for more appropriation, but also we foster adolescent leadership through girls' clubs. The second component is a multi-sectoral, multi-actors action to make meaningful progress to a health, nutrition, and food security outcome and to achieve universal health coverage. This one with many interventions and many stakeholders, as I said, on health and nutrition component, Nutrition International and World Vision, supported by Ministry of Health, strengthen the health system, but also the community health system. And we implement an intensive and comprehensive behavior change intervention program. On the nutrition security component, Nutrition International and World Vision work closely with the Ministry of Agriculture and Livestock to support the production of micronutrient-rich food at the household level, but also in training and giving advisory support to beneficiaries. On the intervention of nutrition governance, mainly Nutrition International and the National Council for Development of Nutrition, our former CLM, work closely with local communities and the regional planning agency to put in place the multi-sectoral planning, coordination, and accountability mechanism. And also they focus their action mainly on integrating nutrition in local plans. On gender aspects, Nutrition International and Development International Desjardins, a Canadian-based organization specialized in microfinance, work closely with the Ministry of Youth for fostering women's economic and social empowerment, and also fostering adolescent girl leadership through girls' clubs. What is the impact? Due to time, I am just going to choose some key impacts, and then if we have questions, we can respond to it. On health and nutrition, the impact was a decreased malnutrition rates from the beginning of the project in 2015 to the end in 2020. Anemia prevalence decreased from 92% to 84% in pregnant women, and from 54% to 37% in women of reproductive age. Another impact was stunting in Kédougou, also decreased from 25% to 60%. And we have wasting in Kolda, which decreased also from 8% to almost 6%. On food security, we saw also a decreased household food insecurity from 31% in 2015 to 90% in 2020. On nutrition governance, mainly the impact was that we integrate nutrition in a local development plan from zero. At the beginning, we don't have any local development plan that have nutrition to all communes in the two regions. That means 39 communes in 2020. Among them, 9 municipalities in Kédougou vote for a nutrition budget line in the development plan. On gender transformation aspect, the impact was an increased access to microfinance loan from 12% in 2015 to 70% in 2020. We also helped 5,500 women to have access to credit to produce micronutrient with rich food against the target of 6,000. For For total credits granted, it was almost 200 million CFA that was granted to women organizations and individual entrepreneurs, among which 170 million were disbursed through financial institutions. What lesson we learn? We don't have much time, but we will go through some of the lesson we learned through this project. On nutrition and health intervention, we improving access to health services for women through advanced integrated strategy combined with free iron, behavioral change communication, and consumption of micronutrition-rich food are key factors in reducing the prevalence of anemia in pregnant and lactating women and women of reproductive age. The optimal use of community nutrition platform support by advanced integrated strategy, improve vitamin A supplementation coverage and antenatal care. On food security, the lesson we learned, 3 lessons: the choice of hardy and reproductive short cycle species and backyard garden help diversify the diet and increase households' resilience and availability of micronutrient-rich food. Also, support in planning, logistic, and human resources for technical services in livestock and agriculture help to increase demand for rural development services close to the most vulnerable and landlocked communities. The last lesson we learned on food security is beyond the economic dimension. Village Saving and Laws Association can be used as a platform to promote good nutritional practice and strengthen women's decision-making power. Lesson learned from nutrition governance, 2 of them. The integration of nutrition in local planning document enable local elected officials to better understand the issue and challenges of undernutrition in the sustainable development of their territories. The second one is coherence and synergy between the different partners working in nutrition and related sector have enhanced the effectiveness and efficiency of the intervention. Last but not least, on gender equality, we have 1 lesson mainly: the use of nutrition as an entry point facilitate intergenerational dialogue at the household level on issues such as reproductive health, child marriage, gender-based violence, and on role of women in the society. All of the things that was not discussed in the past. As a conclusion, we want to compare the result we have with the target, and mainly all results were reached. Mainly, we have 140,000 children under 5 reached versus 115 we were expecting at the beginning, among which we have 68,000 children under 2 that was reached also. We have 41,000 pregnant women and 55 lactating women reached versus 50 pregnant and lactating women. We see that the impact of the project was significant in reducing anemia in women of reproductive age and pregnant women, in improving food security, and in ensuring nutrition governance. And as a way forward, we make recommendation to the government of Senegal for project transition, scale up, and sustainability beyond the current PINK project, with the support of other nutrition partners and donors to maintain its achievement and gains. We also recommend dissemination of the PINK model and intervention with national, which is already done, and international stakeholders to facilitate its replication and implementation in other settings. This is also one of the objectives of this presentation today. Thank you for your attention.
Thank you very much, Bala, for presenting about the PINK project. PINK is an example of a multi-stakeholder, multi-sectoral project that we implement, Nutrition International implemented in Senegal. So just as a reminder to all the participants, the chat is being monitored. So you can put in your questions there, and the presenters and the panelists will respond to you directly on the chat. The next session is the panel discussion. So we have 4 panelists. So I'll pose a question to the panelists. So the first 2 panelists will respond directly to the questions that to the presentations that have been made by both Sise and Bala on the Seqota Declaration and on PINK. So the first panelist I would like to introduce is Dr. Meseret Zelalam. Dr. Zelalem is the Maternal Child and Nutrition Directorate Director at the Federal Ministry of Health in Ethiopia. So, Dr. Zelalem, we've heard from Sise about the Seqota Declaration and the role of the TA that NI is providing to the Seqota Declaration. So my question will be compounded, a number of questions in one, and then you can respond. Could you highlight the contribution of the Seqota Declaration in the fight against malnutrition in Ethiopia, multisectoral coordination in the Seqota Declaration, the lessons learned, and what partners can replicate in Ethiopia and in other countries in their nutrition programs? Go ahead, Dr. Zelalem.
Thank you so much, Dr. Jakuli. Thank you very much, Dr. Sisay, for the great presentation and also the other presenters. And considering the Seqota Declaration, multisectoral coordination and partnership, let me start from the agenda of the Seqota Declaration. Now, the Seqota Declaration is one of the top agenda for the highest leadership in my country, Ethiopia. And I can say we have a high-level steering committee, which consists of the implementing sectors at the federal and the two regions, the Tigray and Amhara region. The head of the states for the regions are really, with this constitute, we are working on the great steering committee. So this is one of the showcase I can explain for this platform. The other thing is we have a multi-sectoral platform whereby the program delivery unit is established. That, as an example, we have established from the federal and regional program delivery unit, which we are now come up with establishing a food and nutrition coordination office in all regions. So this is also the lesson learned from the Seqota Declaration. The other thing is accountability. When we say accountability, number one, we are following the sector's performance every 6 months using a scorecard. The second is we have established a web-based performance tracking mechanisms using the UNIS technology, that is the Unified Nutrition Information System, under the expansion, and then we are tracking this one, and we are also now on under expansion phase. The other thing is we have a remote and unreached satellite-based and solar-powered technology, which whereby using the YASMI technology, we are also having a real-time data for this multisectoral Seqota Declaration activities. The other accountability I can really mention boldly is the government treasury commitment. So from the last 2019 to the year 2021, my government from the treasury has committed 31 million USD for the last 2 years, specifically for the Seqota Declaration. This is a great milestone for my country, which is an excellent time and commitment, I can say boldly. The other thing is we are also working on the resource mobilization. So we are working very well on resource tracking, resource mobilization from donors, groups, and partners as well, aside with the huge government commitment. When we say commitment from the treasury, from the federal, there is also a commitment from the regions as well. From the regional states, there is also a commitment since the start of the Seqota Declaration. And the other thing is we have already implemented 6 innovations. One is the PDU, the Program Delivery Unit at the federal and the regional. The second is the community labs. The third is the data revolution. The fourth is high-tech. The fifth is the first 1,000 days movement, which is a great achievement as well. The sixth is a costed Woreda plan. These are the 6 innovations. Now, whereby these are the best milestone were designated for like giving a solution for multisectoral nutrition challenges. So from this, I can say now we have almost ended with the first phase of the Seqota Declaration, that is the innovation. Now we are working on the endorsed expansion phase for the 700 Woredas. The startup will be to expand on 200 Woredas. Now we are working very hard aggressively to expand based on the endorsed concept note. So I can say we have a great milestone from the very beginning, from the innovation phase, and now this is a critical time working on the expansion. Now I call up for any donors and partners I call up to join hand to support the Ethiopian government, my country's government, my country's commitment on Seqota Declaration expansion phase. I really thank you very much for this excellent platform. We are really thankful for Nutrition International and other donors partnership for this. Thank you. Over to you, Dr. Jacqueline.
Thank you so much, Dr. Meseret, for really highlighting a project that shows government commitment to a multi-sectoral, multi-stakeholder nutrition program, as Seqota Declaration is. So the next panelist that I would like to introduce is Mr. Abdullahi Ka. So Mr. Ka will respond to a question that is directly focusing on the PINKK project that Bala presented. Mr. Ka, what was the role of the government of Senegal in ensuring successful multisectoral coordination in the PINKK project? And what are the lessons learned from PINKK that can be replicated in the entire country in efforts to improve primary health care and attain universal health coverage?
Thank you. Thank you very much for this, for your question, and for also inviting us in this very interesting session. This is in line with the nature and the quality of our relationship with the Nutrition International in Senegal. First, I would maybe give some elements regarding the context of Senegal when we talk about nutrition and our multisectoral approach. Just to remind you that in Senegal, we have been developing this multisectoral approach since early 2000 with the institution we have and in charge of coordinating our nutrition policy. And we have been really working on this, the development of this multisectoral approach and also institutionalizing nutrition. And this process has brought us many good results in our country. And you know that now we have a National Council for the Development of Nutrition since this year. Anchorage at a very high level, the General Secretary of the government. We have also a multisectoral policy document and a multisectoral also strategic plan. So the conditions are really in place for the different partners to really contribute to our multisectoral approach when it comes to developing nutrition in Senegal. And Nutrition International with the PINKK project is really aligned with our approach of really putting in place sound strategies linked to the context of the different regions that are targeted. And we did, let's say, support NI in developing this multisectoral approach in 2 regions in Senegal, because it was a kind of test for us also regarding our multisectoral approach. How can we really attack the underlying causes of stunting in our areas of intervention, and also because we know in the south of Senegal, stunting is one of the key issues, and also micronutrient deficiencies. So we really share the good results that we have with the project PINKK project, and we are also engaged in developing this type of approach elsewhere, and also taking the lessons we have learned. And when it comes to the universal health coverage and primary health care, what we have some key lessons that we are really developing now in other regions. The first is regarding the package of services that we have at the community level. with our first 1,000 days approach. It's really important to underline that the pregnant women are a priority for us when it comes to targeting the most vulnerable population. We are really promoting the antenatal care, nutrition education, iron supplementation, as the PINKK project did. And we are also fighting against the financial barriers that that we have in our countries regarding the antenatal care visits. And we are promoting the development of cash transfers to the pregnant women that have the financial barriers. So some innovations also are developed in other areas that we are covering with our national nutrition program. One important lesson also is regarding the primary health care and how the nutrition platform can also allow the development of IMCI, the management of childhood illness at the community level, with the promotion of complete vaccination, micronutrient supplementation. Because you know that when we develop the growth promotion at the community level, it's a great opportunity for the also primary health care to be developed. We are also developing, and it's a strong lesson, this a strong referral system with the health system also, to link the community level to the health infrastructures also. We are supporting also the universal health coverage strategy in Senegal by from the nutrition platforms. We are also promoting the subscription of communities in the health mutuals. For us, it's really important, and we give the example by supporting the most vulnerable households to be enrolled in the health mutuals. Regarding nutrition governance also, as the project, the PINKK project did, with supporting us in developing the tools to integrate nutrition in the planning process at the decentralized level. We are promoting the scaling up of this approach of the nutrition governance to really integrate nutrition and health in the local development plans, because we know that this is a strong way that we have found to really sustain our multisectoral approach at the community level. So these are some key lessons I wanted to share with you, knowing that we are moving forward in Senegal with also other partners in our national projects and programs to really support the universal health coverage. Thank you. Back to you.
Thank you very much, Mr. Ka, for highlighting the role of the government in just ensuring sustainability and scaling up of the different components of the PINKK project. So my third panelist is Mr. Gautam Kandru. Mr. Kandru is a nutrition lead at the Exemplars in Global Health Gates Ventures. So my question to you, Mr. Kandru, is how are donors supporting governments to make policy and financial commitments to more fully integrate nutrition interventions into national health systems as an important component of ensuring quality universal health coverage?
Yeah, thanks, Dr. Jackie. It's a great question that you've raised here. I guess maybe just starting off with a little bit of context around the Exemplars in Global Health platform. The EGH, or Exemplars in Global Health project, is a project incubated at Gates Ventures, the private office of Bill Gates, and launched in close partnership with the Bill and Melinda Gates Foundation. And in many ways sort of positions us uniquely to weigh in on this dynamic as we work closely to drive evidence to impact with stakeholders and decision makers at the country level, spanning ministries, funding partners, implementing folks, and norm setting bodies as well. And the model here is really based on the idea that one of the best ways to identify best practices or ways to sort of work together to accomplish outcomes of interest in global health is to understand exemplars or positive outliers. In other words, countries where we have seen accelerated progress on health outcomes, to identify and share those lessons that can serve as the basis for replicable and sustainable success. And so with that in mind, just wanted to thank you and the fellow panelists in particular. Great to see Dr. Messeret and Mr. Ka, as our program has identified Ethiopia and Senegal as exemplars in stunting reduction in particular, making extraordinary progress in reducing stunting burden despite contextual challenges and headwinds. And sort of bastions or exemplars for highlighting what we can and should be learning. And, as we're thinking about the common themes or successful outcomes that we've observed in our lessons learned, there's been a real emphasis on strategic partners with global funders, as well as country level stakeholders to facilitate research collaboration, capacity building opportunities. And it represents a real emphasis around crafting evidence-based policies in consultation with global peers and technical advisors. But to answer your question a little bit more specifically, we have to acknowledge, of course, that 2020 was marked as one of the most severe global food insecurity increase moments in our time, right? Impacting in particular vulnerable households in almost every country and compromising nutritional status of many worldwide. Estimates from the latest modeling have put projections at upwards of 6.7 million additional children wasted or at risk for wasting of under 5. And the challenges of COVID in many ways have actually highlighted existing global disparities that have, of course, strained systems from funding all the way to execution. But at our core, in terms of what the role of governments and donors are in scaling up nutrition, the global goals around effective partnerships and commitments around nutrition remain the same at their core, which is 2 dimensions, more money for nutrition and more nutrition for our money. And so what we mean when we're talking about more money for nutrition is really focused around evidence-based advocacy. As we're thinking about the key messages that both government stakeholders and donors need to bring to the table. Even before the COVID-19 pandemic, nutrition has been underfunded. Now, in an environment where ODA is limited, and it is critically important that we secure and emphasize the need for continued and coordinated in-country support and government-led commitments to multisectoral nutrition interventions. These are challenges and priorities that must be called out, must be elevated by both governments and donors. And part and parcel with this is the message that we have to land on seeing scaling up nutrition and health interventions as true broader investments in human capital, one that see returns reflected in healthier, more productive and resilient populations. But in many ways, on the flip side, the COVID-19 crisis is an opportunity to make nutrition, with its clear connections to more severe consequences and outcomes, a sustained priority for countries. And the second half of the nutrition statement here is around more money for our nutrition. So a focus on implementation in particular, characterized by requisite commitments and investments in broader multisectoral systems. So while as we're thinking about key lessons that or takeaways to ensure that systems are resilient and that they can promote sustained change. One of the bigger lessons around this were really around country level ownership, as we've seen from both the efforts in Ethiopia and Senegal, effective donor coordination, pro-policy agendas, in particular targeting to make sure that the most vulnerable populations are thought of and have equitable access to progress. And ultimately, as a part of doing this effectively, to elevate the voices of leaders, especially in countries like Ethiopia and Senegal, to drive conversations around how countries with similar challenges can work together to achieve the best possible results.
Okay, thank you very much, Mr. Kandru, for representing the donor community and just highlighting to us how donors can support countries. My last panelist in panel 2 is Dr. Richard Pendame. Dr. Pendame is the Regional Director for Africa at Nutrition International. So my question to you, Dr. Pendame, is what concrete measures is Nutrition International undertaking to ensure nutrition-related actions are integrated into national health systems to improve the coverage and quality of essential nutrition actions?
Thank you, Jack, for that question. For 25 years, Nutrition International has remained committed to its core vision, a world where everyone, everywhere is free from malnutrition and able to reach their full potential. In keeping with this vision, Nutrition International realizes that nutrition-related actions cannot make a meaningful progress unless they are integrated into national health systems, especially the primary health care component of the health system. To ensure that nutrition-related actions are integrated into the primary health care, Nutrition International has taken and will continue to take the following concrete measures. First, partnership with national governments for scale-up of nutrition actions. Nutrition International has prioritized the national governments as the main partners for delivering nutrition-related actions to scale. Nutrition International, therefore, provides technical and financial support to the national governments to ensure that low-cost, high-impact interventions that target vulnerable populations, especially women, adolescent girls, and children, are planned and delivered as a package of services for maternal and newborn health, child health, adolescent health, and health education, which are the key components of the primary health care. We do this by helping governments in actually integrating nutrition in all the 6 pillars of the health system. Just to highlight on the 6 pillars. First is the governance and leadership. We ensure that national UHC plans integrate nutrition and align with national multisectoral nutrition plans. Second pillar is health workers. We aim to help government to ensure that health workers are properly trained and they are able to integrate delivery of interventions across the life course. On health service delivery, it is we help governments to increase the effective coverage of essential nutrition actions through health system with a focus on reaching those most left behind. We also support access to medicines and nutritional related health products by ensuring that essential quality assured nutrition related health products are included at national in the national essential medicines list. In financing, we actually work with governments to ensure that plans are properly costed and advocate for allocated domestic resources to the national health system. And finally, health information system, we ensure that national health information systems include indicators, nutrition indicators to track coverage and quality of essential nutrition actions. The second action is a partnership with global and regional bodies for policy formulation and advocacy. At global level, Nutrition International collaborates with other key nutrition players such as UNICEF, WHO, the SUN, and through global alliances such as Gavi in ensuring that policies, guidelines, and tools that support scaling up of nutrition-related actions through national health systems are developed and are available to countries. In addition, Nutrition International provides technical and financial support to national governments to ensure the adoption and implementation of these policies, strategies, and tools. At regional level, Nutrition International collaborates with regional bodies such as EXA, African Union, African Development Bank, the West Africa Health Organization, and the WHO Afro Office in advocating the need for member states to prioritize the integration of nutrition-related actions in their development agenda, as well as their national health systems, especially primary health care system, so that all citizens can access quality nutrition services close to where they live. Third, we provide technical and nutritional assistance to countries on multisectoral response to malnutrition. While universal health coverage should be health system focused, Nutrition International believes that it should also be multisectoral driven, as nutrition and health outcomes are determined by a variety of social, economic, physical, environmental factors. The multisectoral nutrition actions are needed in order to make a meaningful progress towards health and nutrition outcomes, to achieve the 7 health and nutrition-related SDGs, and specifically to achieve UHC. The 2 examples presented today, the PINKK and the Seqota Declaration projects in Senegal and Ethiopia, respectively, are good examples of nutrition, of the multi-stakeholder, multi-sectoral projects that the NI supports with the objective of supporting government scale up through multi-sectoral nutrition actions and providing opportunities across countries to learn between countries in the region. With PINKK, Mr. Carr has told us how lessons learned from PINKK are replicated and scaled up through Senegal. With the Seqota Declaration, Dr. Cisse has highlighted how NI's technical support contributed to the successful implementation of innovation phase of the Seqota Declaration. With this success, NI will continue to provide technical assistance through secondment of Dr. Cisse to the Seqota Declaration Delivery Unit to contribute to the implementation of the expansion phase of the Seqota Declaration. Finally, through our NTEAM project, Nutrition International has and continue to provide technical support to 20 SAN governments, in 13 of which are in Africa and 7 are in Asia on multisectoral nutrition coordination. The technical support provided falls under the following work streams: institutional capacity building for effective coordination of key nutrition stakeholders, development of costed multisectoral nutrition plans at national and subnational level of governments, improvement of data for planning and decision-making, development and institutionalization.
La planificación y la decisión.
So in summary, the TA has provided ensuring that nutrition-related actions are integrated into health, education, water and sanitation, and agriculture and trade systems. Thank you, Jack, for that question.
Thank you very much, Dr. Pendame, for highlighting the work that Nutrition International does at the global level, the regional level, and at national levels in Africa. So as a way of summary, we have heard from the presenters in panel 1 and the panelists in panel 2. And also, just as a reminder, I've been monitoring the chat and the different presenters have been monitoring the chat. I've seen that a number of questions have been answered. And if you still have any last minute questions, we have very little time, but you can just type directly into the chat and they'll be responded to. But what I want to say to close this session is just to summarize, is to give 3 recommendations that we've come up with as a result of the different presentation and panel discussions. The first recommendation is that governments and partners should implement multisectoral actions. We've seen this through the PINKK project and the Seqota Declaration, and these are important in making critical progress towards achieving the nutrition and health related sustainable development goals and UHC, universal health coverage. The second recommendation is that government and partners should operationalize concrete measures, including national and subnational nutrition action plans, to ensure nutrition-related actions are integrated into health systems to improve the coverage and quality of essential nutrition actions. And lastly, governments and partners are encouraged to make policy and financial commitments to more fully integrate nutrition interventions into national health systems as an important component for achieving quality UHC. I would like to thank all the presenters in panel 1, all the panelists in panel 2, the participants for very patiently being a part of our session and for typing out the questions. As a way of housekeeping, I've been asked to remind you that other sessions are still going on. So you can join through the auditorium, visit our booths. At the booths being displayed, the Nutrition International booth is one of the booths in the display session. Kindly visit our booths. Thank you very much for this wonderful session.
Thank you very much, Dr. Jacqueline, Dr. Pandema, all colleagues, and I also appreciate Dr. Sisai's presentation. We'll keep going on the collaboration and partnership. Thank you. Over.
Thank you, Dr. Masret. Thank you, Jack.
Thank you, everyone. You're free to leave. You can join the other sessions and visit our booth.
Thank you, everyone.
Thank you. Thank you, everybody.
Thank you, Abdulkar.
À bientôt.
À bientôt.
Merci.
Jërëjëf.
Jërëjëf, merci.
Abdoulaye, merci beaucoup.